basically, the gallstones are usually diagnosed on an ultrasound, and the ultrasound is the most sensitive investigation to diagnose gallbladder stones. Most of the time, many times patients with gallstones have the typical gallbladder symptoms. Those patients are called symptomatic gallstones. But on the other hand, a lot of patients are also diagnosed with gallstones in the absence of symptoms. These are patients who undergo a general health checkup, a whole body checkup, as a part of a general health plan, in which the stones are picked up with no history of any abdominal pain in the upper abdomen. Then patients who are undergoing ultrasounds from other reasons, like for example for gynec problems, for fever, loose stools, and other symptoms which are not attributed to the gallstones. Also, then you have a third group of asymptomatic patients, basically where the gallstone pain is a very typical pain. It occurs in the location of the gallbladder, that is in the upper abdomen or on the right side, and this pain is a very memorable kind of pain. The patient will say that, on that particular day, at that particular time it started. So, sudden onset pain, fairly moderate or severe pain. It's usually after a meal. It starts in the middle of the night, in the late evening or the middle of the night most of the time, and it lasts for a couple of hours and then subsides by itself, and it goes to the shoulder or the back, and it's associated with vomiting. So, these 7-8 characteristics, when they have, we call them gallstone pain. So, when patients have other pain in other parts of the body, on the left side or the lower abdomen, even those symptoms are other GI symptoms which are not attributable to the gallstones. Even those patients, we call them asymptomatic gallstones. So, asymptomatic gallstones basically constitute patients who don't have any symptoms attributable to the gallstones. They could be a part of an asymptomatic patient as a part of a general health checkup. They could be found out while evaluating for some other abdominal problems, or patient may have come with pain, but we think that this pain is not due to gallstones. So, these three categories of patients, we call them as asymptomatic gallstone patients.